Okay, welcome back, friends. This technique is another great one. It's actually a $1 million technique for free today. It's the Brainstem-Release. This is a technique you can do just by its own. It's a wonderful standalone technique to release tension in the brainstem region, C1 region, suboccipital region. If you combine it with a meningeal release technique that I taught you before, this is extremely powerful. If you combine it, you would first do your regular treatment, get rid of all the subluxations, then you would do the meningeal release, and after that you would do the brainstem release in the suboccipital region. It's very simple, but it's extremely powerful. Just one important thing, don't be mistaken. This is nothing like a regular suboccipital muscle release with like holding the fingers up and just letting the muscles release like you know it from SOT or osteopathy. The direction of tension that you use with your fingers and the 3 points that I'm using is very important. It makes a whole lot of a difference. So you have to stretch the muscles and the fascia into a very specific direction to really get all the benefits of this technique. It doesn't work if you just press in. That gives you some release, but that's not the real technique. So pay attention to the direction and you'll love the results. So we have a patient here. Face down, please. So you want to have the headpiece a little lower. So there's going to be 3 points on both sides that you will use with your hands. First is where the paraspinal muscles are attached to the occiput. So you're not on the skull, you're a little below, where the paraspinal muscles attach to the occiput. That's the first point. The second point is right besides that, those little grooves that you find here. It's the splenius capitis going in there and some parts of other muscles. So this is actually the grooves that all you KST doctors know from doing the occipital drop, because this is where your thumbs slide in. The third point is going to be right behind the mastoids. So there's a lot of muscles attaching here too. It's the sternocleidomastoideus and other muscles. So you're going to be not on the mastoid, not directly below the mastoid, but a little behind the mastoid. And the release is going to be like this. You first take your fingers and you go to the paraspinal muscles. Just EOP, go down where the paraspinal muscles attach to the occiput. The direction of pressure is going to be 45 degrees downward and 45 degrees outward. So it's going to be something like this. And this direction is crucial for the success of the technique. So you're going in, you take up the tissue slag, and you go in 45 degrees and out 45 degrees. And you just hold this pressure for 10 to 20 seconds. Usually it's about 10 to 15 that is enough. Many times you will feel a pulsation in the muscles or kind of like a twitching in the muscles when it releases. You use pressure so you feel the soft tissue, but it's not as so hard that it's uncomfortable for the patient. It should always be comfortable. So you hold 10 seconds and you let go. The next part is the grooves next to the paraspinal muscles, right below the occiput. The splenius capitis attaches. I like to use my thumbs on that. You can use your fingers too. So you glide down the occiput, you find the grooves. You slide in, take up the tissue slag, and now again it's 45 degrees down and 45 degrees out, like this, and you hold. Don't make the pressure too hard, it should always be comfortable. Most patients like it a lot. Sometimes there can be a little tension that feels a little uncomfortable when you press on it, but usually all the patients love this maneuver. And again you hold for about 10 to 15 seconds. I feel nice little twitching in the muscles here on the left, like a pulsation happening, and it releases, and then you let go. And the last position is you move out to the sides. You're behind the mastoids, and you go in 45 degrees and out 45 degrees, and you hold this again for around 10 to 15 seconds. Again, it's 45 degrees down, 45 degrees out. So the whole technique, if you combine it, takes less than a minute. And this is a very, very powerful release. It releases the muscles all the way down, and most important, it releases the fascia, it releases nerve attachment, it just takes off the pressure of the brainstem. And it will make your corrections hold a lot easier. Combine it with a ninja release, very powerful. So this is the technique. Thank you.